Hello and welcome to today's program. As you may be aware, Zambia has been hit by a cholera pandemic which has claimed so many lives in our communities. And it is for this reason that the Ministry of Health and other partners have come on board to just help and sensitize the public in doing what is right. We cannot leave this problem to the Ministry of Health alone. And so on this program, Health Chat, we will be focusing and featuring so many experts from the ministry and other stakeholders to come and sensitize the general public. Our focus today is handling of the cholera patients. To help me discuss this important subject, I have with me Mr. Michael Mwamba, who is the Environmental Health Officer from the ministry. Welcome to the program.
Thank you so much. Welcome viewers to our program.
Thank you so much. How are we doing as Zambia National Public Health Institute?
Thank you so much, Faith. Indeed, just like you have said, the issue with cholera is not only for Ministry of Health or Zambia National Public Health Institute. Everybody, the entire community, the entire country, we have to come in on board and fight this epidemic. How we are doing as Zambia National Public Health Institute, you may be aware that the mandate of Zambia National Public Health Institute is to coordinate all the public health events in the country. And how we are doing, we are coordinating the fight against cholera, and we are in the field currently providing support and leadership to the fight against cholera.
Thank you so much. We start with, or maybe by looking at what a person should do in case they see that a relative at household level, that is, presents himself or herself with vomiting or maybe diarrhea. What should be the first thing that this person should do?
Thank you so much, Faith. Those are typical signs of cholera. So once anybody, a guardian or a parent or anybody at household level sees those signs at home, vomiting and diarrhea, more than 3 times in a day, don't even delay, but rush to the nearest health facility for support and help.
Okay. So how should we handle such kind or this person? Should we isolate them? Should we maybe call for an emergency line? What is it that we're supposed to do? Immediately we notice that there are these signs in this patient.
Depending on where we are, when we see such signs in anybody, we need to quickly organize transport and take that person to the nearest health facility. In case maybe you are in a village setup where there are ox carts at Vikochkala, just organize one and take that patient to the nearest health facility.
Okay.
Yes.
All right. Now, there are cases that we have seen and we have heard. Others are just presenting themselves with diarrhea without vomiting or vice versa. Can we qualify that to be cholera as well? Or maybe it is just the normal diarrhea? How do you attest to that?
Okay, yeah, indeed, there are some who are presenting with only vomiting, others on diarrhea. But our experts in all the CTUs are cholera treatment units, and the cholera treatment centers like Heroes. We have experts there. They are able to test and say whether it is cholera or just a normal diarrhea. Yes.
Now, when we look at the distance, others are coming from these far places, compounds and all.
Yes.
Is this the only center that we're supposed to take our patient? Are there any other centers that we're supposed to take our patients to, apart from the Heroes?
Actually, the system which has been devised is that it's not the caregivers to take the patient to the cholera treatment center. But when you, for example, if you're in Kanyama, we have government clinics there, about I think 2 or more. There is the Kanyama Self-Help, and there is Kanyama West there, the clinic, and the Kanyama Main, which is the first level hospital. So if you are found to be a suspect of cholera, you'll be taken to maybe the first level hospital. And the first level hospital, once they assess the patient and they feel that this patient can be referred to the next level, which is the cholera treatment center, they can either refer to Levy Hospital or Heroes Hospital. So this is the system which is there on the ground.
Okay. There's, you know, some interests with relatives. They would want to know where the patient is. You know, at times they would go maybe to Levy, they are told, no, your patient is not here. They go to Kanyama, your patient is not here. What is the procedure, or how is the procedure like? How are the relatives supposed to know where their patients are?
So a cholera patient, when they are brought at a suspect, when they are brought in as a suspect at a facility, there will be names taken there. There's a cholera register. Okay. They will write the names in the register. They will pick all the important information, the household, the contact number, their residence, and the next of kin. So all such information will be picked and entered in the register. And once the patient is seen or assessed and is sent to the next level, the officers there will know where the patient has gone, and they will be able to inform the caregiver that your patient has been referred. Normally, there are ambulances which are found at the clinics there. Once they refer, they are picked in the ambulance and taken to the treatment center.
Okay.
Yes.
All right, viewers, we are looking at the handling of cholera patients. Let's take a break.
Kodi kolera ndi chani?
Kolera ndi matenda othulula. Munthu amene adwala matenda ya kolera amathulula kwambiri ndi kusanza. Dothi lake limakhala ngati madzi momwe atsukira mpunga. Ndipo munthu odwala kolera, madzi mthupi lake amatha kamba kakuti iye amachoka kwambiri kupyolera mkusanza ndi kuthulula kwambiri. Munthu odwala kolera angamwalire m'maola 12 kaya kuti 12 hours ngati sanalandire mwamsanga thandizo la mankhwala.
Kodi munthu angatengere motani matenda a kolera?
Kumwa madzi adothi, kudya zakudya ndi m'manja mosasamba mwadothi kapena kugwiritsa ntchito mbale zotsukiwa ndi madzi adothi. Kudya zakudya zimene zinangosiwa mosasamala posabwinikira. Kudya zakudya zozizira zachimbala zimene sizinasungiwa bwino. Kudya zakudya zimene amagulitsa mphepete mwa misewu. Kudya zipatso ndi ndiwo zamasamba zosatsuka.
Kodi kolera ingachinjiriziwe?
Gadusani madzi anu akumwa kapena kugwiritsa ntchito chlorine. Sambani m'manja ndi madzi aukhondo ndi sopo mukamaliza kugwiritsa ntchito chimbudzi. Funditsani zakudya mukalibe kuyamba kudya. Osadya zakudya zimene zimagulitsiwa mphepete mwa misewu. Muyenera kubwinikira zakudya kuopetsa kuti ntchentche zingakakeko. Nthawi zonse muyenera kugwiritsa ntchito chimbudzi. Pewani kugwiritsa ntchito machemba kapena maplastiki ngati chimbudzi. Onani kuti dothi litayiwa mchimbudzi. Nthawi zonse onani kuti zimbudzi zikhala zaukhondo ndipo nthawi zonse pambowa wa chimbudzi chanu pazikhala pobwinikira bwinobwino. Okubweretsani uthenga uyu ndi aunduna wa zaumoyo.
Welcome back. We are looking at the handling of cholera patients, and with me is Mr. Michael Mwamba, who is coming from the Zambia National Public Health Institute, and he is the Environmental Health Officer. Maybe we look at the rumors, you know, that are being spread all around. Do we have enough caregivers? And if so, do they even have protective clothing?
Okay, yeah, those rumors, we are also hearing them as well. We know about those rumors. Caregivers.
Yeah.
Okay. You mean caregivers or the...
Not the bedsiders, but the health workers, yes.
Okay.
Yes.
Yes. Health workers, they are there at the cholera treatment centers. So far, so good. In the first few weeks, we had some problems here and there, but now the treatment center is operating at full fed, and patients are being taken care of.
Okay.
Yes, currently.
Protective clothing?
The PPE, protective clothing, all the officers who are working there are monitored. They are supposed to have PPE from head to toe, and the new recruits who are there working, before they go into the treatment centers, they are being oriented by ZNPHI, especially on infection prevention. They are oriented, that's when they are sent in those areas, because the area can be infectious. And we have the environmental health officers who are trained to disinfect the areas there. Every time you go there, if you are not strong, others can even faint because of the strong granular chlorine, which is spread all over the places there. The place has to remain wet because of the granular chlorine all the time. Yes.
These patients which we are having in these cholera centers, in case one has been discharged, how are you transporting them back to their residence? Is it the families to come and pick them, or there is a way which the hospitals are doing it? Because we might not be so sure if you just discharge this patient, gets onto a bus, going back to their places. Is there a way where you are helping these families to make sure that they reach their destinations well?
All right. Just like we started with the program in the beginning, we mentioned that we are not working alone as Ministry of Health, but we are collaborating with other line ministries and other stakeholders. Currently, some of our partners, they have contributed buses. So when the patient is discharged, or patients are discharged, they are picked in a bus, and they are dropped to the nearest place of their residence.
Okay.
Yes, that's the system which is there on the ground at Heroes Stadium and at Levy. Yes.
Okay. And once that is done, are the relatives being informed to say your patient has been discharged, or maybe the next of kin? Are they being informed to that effect? Yes.
The next of kins or the relatives are informed that your patient has been discharged, and some relatives are found near there at Heroes. They'll be told that, oh, your patient has been discharged, so you can go with them now.
Okay.
And once they are discharged, we have the health promotion officers who are there to give them the do's and don'ts, so that we don't readmit them with cholera again at the facility. They are given health education and some chlorine as they go back home, so that they continue promoting good hygiene practices at home.
At home, yeah. And now, upon death, there have been complaints to say the relatives are not being informed in good time. How is the procedure like in case a person dies in a treatment center? How are you getting in touch with their relatives?
Like I mentioned, whenever we have such issues like cholera and other things, we have registers,
Yes.
which are called cholera registers, where we pick all the important document, all the important demographic for the patient and their relatives, next of kin, contact numbers and the rest. So when somebody dies, of course the people in charge there will look for the next of kin and inform them about the death of their relative and the next step to be taken.
Okay.
Yes.
Right. The issues of bedsiders, because we have seen quite a lot of people hovering around Hero Stadium, especially. What is your word to those? Because are they supposed to be there? If that is the case, what is the arrangement? How are they supposed to handle themselves?
Yeah, just that sometimes as people, we take time to listen. Otherwise, the people are not supposed to be there. Okay. Because cholera is an infectious disease. It is an infectious disease. It can spread through various mediums, like flies, the food that we eat, water, and other things like it can be spread by getting exposed to the things, to the soiled clothes or soiled gadgets or instruments which people have been using. So people are not supposed to be near there. They are supposed to be home taking care of themselves. Yes.
Okay. We've looked at that one in terms of bedsider. And we've heard that when a person dies, it is the health personnel to take charge and just to take care of the rest. How about funerals? How do we treat that? Because just as you know, customs and norms, people are supposed to gather, people are supposed to just have and feel to give their beloved one a befitting funeral or burial. How are they supposed to treat it in terms of funeral gathering?
Yes, okay. So in a normal setup, if we don't have any epidemic to fight or any contagious disease to fight, funerals are held in a normal way. But in this case of cholera, if a person dies of cholera, there is a system that we use. Yes. We don't just, we don't allow like relatives to touch the body, but only experts or professionals are the ones to touch the body. So we work in conjunction with the council. Once the Minister of Health certifies that this person is dead, the council takes over. Local authority takes over. They will disinfect the body, and they will put the body in what we call the cadaver bag, the plastic-like. They will put the body in there, and for those relatives that would want or wish their relative to be in a coffin, they would come with the coffin and present it to the experts, and the body will be put there and disinfected. Okay. Then that's when it will be taken for disposal. Yes.
Okay, I'm getting that one because that was one of the issues which we had to say, no, they don't allow coffins. Now that you have put that to light, maybe the public can be, you know, sensitized to say even this one is possible, it can be done. Because all we hear is, no, you cannot be near this body, you cannot even take a coffin. So please just maybe an emphasis on the last point which you made in terms of getting coffins for our beloved ones.
Yes.
Yes.
I've even seen some clips on that as well.
Yes.
But from what we have seen so far, some people have been negotiating with the experts there to bury their relatives in a coffin-like, but it has to be disinfected, and it has to, the relatives has to work in collaboration with the expert. For them to be like guided on which type of the coffin they should like bring, so that they bury their relatives, their relative in a way they would like them to be like. Okay. Yes.
And as government, do we have a designated place where we are burying these bodies?
Okay, just like I said, the local authority, they have a mandate to support on the disposal of the dead. Where they feel they have space to bury, that's where they take the bodies for burial.
Okay.
Yes, otherwise in Lusaka here we have leopard seal and we have chingwele.
Okay.
Yeah, so depending on where the local authority feels they can take the bodies, they will decide on where to take the bodies for burial.
Okay.
Exactly.
And maybe even the relatives are equally informed on where the bodies will be taken, or it is just up to the council to take the body where they feel there is space?
Relatives are informed that we are burying these bodies this side.
Okay.
Yes.
All right.
Exactly.
All right. Okay, maybe in closing, what would be your word of advice, your word of appeal to the general public on how to handle, cholera patients? Because there are so many myths, which are going around, more especially on social media. What would be your word of advice?
Yeah, the word of advice can be mouthful. One, I would say cholera kills. Cholera is a deadly disease. So we need to prevent it to come to us. And the preventive measures, we have continuously mentioned that please boil your drinking water. If you are in an area where your water is coming out with some foreign materials or it's dirty, boil it. And if you have chlorine, you chlorinate your water. And in an area where you don't have proper sanitation like flushable toilets, always ensure that you wash your hands when you are coming from that toilet or that pit latrine. And if you see that your relative is presenting with vomiting, diarrhea for so many times in a day, rush them to the nearest health facility to seek for treatment and care. Then, cholera cannot be killed by cachaso or Bose or Jameson or these other strong beers. No. All the people that are found there, some of the people that are found there, they are people who are heavy drinkers, but they have cholera. So we need to know that by drinking too much beer, you can't prevent cholera. You can only prevent cholera by following the procedures, which we keep on mentioning day and night. Yes.
Well, Mr. Mwamba, thank you so much for appearing on set today.
Thank you so much, Faith. We are always at hand. If you call for us, we can come and continue to sensitize the public. Please, public, take care and follow the guidelines which are there. Maybe I mentioned one thing.
Yes.
There will be a vaccine which the minister will receive some cholera vaccines soon.
Okay.
Maybe today or some other days to come. And the minister has emphasized that the experts, in fact, working with the minister, have said that they will start with the hot spot areas. So those who are not in the hot spot areas, let's stay calm and wait for the further guidance. The vaccine, the doses are about 1 million plus, but those vaccines will be given accordingly. So let's just be patient. Don't move from your area to another area because that will be again a source of concern. So please just be calm wherever you be. The vaccines will come to you. Right. Yes.
Well, viewers, you've heard for yourselves, and let's try to keep safe as we observe the guidelines. Today, we're focusing on the handling of cholera patients. I had in the studios Mr. Michael Mwamba, who was coming from the Zambia National Public Health Institute. He is the Environmental Health Officer. From me and the entire production team, it's goodbye until next time.